Hello, everybody. Hello and welcome. Can everybody hear me? Let me know in the chat, and we will go ahead and get started on our week 4 ICD-10 guidelines. I'll just wait until I get a few responses in the chat. All right. I'm getting some hellos. Awesome. Hello, everybody. All right. Well, as always, hello and welcome to another week of ICD-10-CM Guideline Mastery Sessions. I am Ms. Haley. I'm going to be your lead instructor for this class, and I'm so excited, as always, to welcome some new and returning coders to our Monday night class. We are going to be beginning our week 4. So today we will be going over and reviewing some endocrine, some mental health, nervous, and eye disorder guidelines. I'm going to be using our ICD-10-CM guidelines and also referencing our MCG manual in this session as well. So be sure you have those both handy. And we will also be playing our live Kahoot game at the end of the session to test our coding guidelines skills. I did see some of the feedback about the Kahoot. So at the end of the game, I will definitely do a short review of the questions and go over the answers to clear up any questions that you might have so we can fully understand the guideline questions, and we can also have a little bit of competitive fun. So without further ado, let's go ahead and get started. All right. I'm going to go ahead and read our copyright real quick. So ICD-10-CM copyright 2026, American Medical Association, all rights reserved. Fee schedules, relative value units, conversion factors, and or related components are not assigned by the AMA, are not part of CPT, and the AMA is not recommending their use. The AMA does not directly or indirectly practice medicine or dispense medical services. The AMA assumes no liability for data contained or not contained. ICD-10-CM is a registered trademark of AAPC. AAPC content found within this presentation is copyright of AAPC. Keyword concept: FTR, Chun, AMCI Fab 7, AMCI ICD-10, FLIP, TAP, and MCG are trademarks of AMCI. The credentials CPC, CRC, COC, CPMA, CPB, CPPM, CPC are owned by AAPC. AMCI does not own the rights to these credentials. The credentials CCA, CCS, CCS-P, RHIA, RHIT are owned by AHIMA, and AMCI does not own the rights to these credentials. All right, that is a mouthful. So now that we have that out of the way, we are going to go ahead and warm up with a few questions so then we can move into some more in-depth scenarios later. Are you guys ready? All right. Let's go ahead and get started with our first question. All right, first warm-up question of the night. When the type of diabetes mellitus is not documented in the medical note, what is used as the default type? I'm going to give you guys just a few seconds, and good luck. All right, amazing job. That was a pretty easy starter question to start the night. You guys killed this one. So we are going to be using our Chapter 4 guideline from Endocrine, Nutritional, and Metabolic Diseases. And this is going to be when the type of diabetes is not documented. The default is going to be E11.9, and that is going to be type 2. So everyone was correct. I think everyone got that one right. It is going to be type 2 diabetes. Amazing, amazing. All right, let's go ahead and get started on our second. All right. If a diabetic patient uses insulin and the type of diabetes is not documented, what type of diabetes would be coded according to the guidelines? You guys have just a few seconds. All right. We are going to go ahead and look at the guideline. All right. So the guideline that we're going to be using is again going to be from chapter 4, and it states that if diabetes mellitus type is not documented, but insulin or other medications are recorded, you are still going to be assigning the E11, which is going to be type 2 diabetes. I tried to be a little sneaky with my words, and you would technically be right because the use of insulin is not indicating the type of diabetes. So if you did put B, you are definitely on the right track. But if you look into the guideline, you can just see further that it does not specify the type, but if it's not documented, that you should be using type 2 diabetes. So great job. Amazing, amazing. Let's keep this going and move on to our next question. All right, so next question. According to the ICD-10-CM guidelines, how is bilateral glaucoma of the same type in the same stage reported? Is it going to be A, one code is used to report the type of glaucoma, the stage of glaucoma is not reported? B, a bilateral code can be used to report the type of glaucoma and the stage of glaucoma? C, 3 codes are reported, 1 code for the type of glaucoma and 2 codes to indicate the stages. Or D, 1 code is used to report the stage of glaucoma, the type of glaucoma is not reported. I'll give you guys a few seconds. All right, we are going to go ahead and get started on this explanation. So this is going to be the guideline we are going to be using. It is from Chapter 7, Diseases of the Eye and Adnexia. So this is going to be the code, or the guideline. So a bilateral code can be used to report the type of glaucoma and stage of glaucoma. The guideline states that when a patient has bilateral glaucoma and both eyes are documented as the same type and same stage, and there is a code for bilateral glaucoma, report only the code for the type of glaucoma, bilateral, with the 7th character for the stage. So for this guideline, definitely make sure to look out for the keywords same type and same stage. If this would be, if this was a scenario with a different type and a different stage, then we obviously wouldn't be using this guideline. So always be sure to look out for specific wording when deciding on which guideline to utilize. But thankfully, this says same type and same stage. So this is going to lead us to an answer of a B, which I believe everyone got right. So nothing is tripping you guys up tonight. You guys are starting off super strong. Amazing job. And we are going to move on. I think this is going to be our last warm-up question before we get started. So true or false? When the provider documents the use, abuse, and dependence of the same substance, and all are present in the documentation during the encounter, code all of them. Is that going to be true or false? I'll give you guys a little bit of time. All righty. Great participation in the chat. You guys are doing awesome. So as always, this is going to be the guideline we are going to be using. So the dependence on tobacco is the only code reported based on the hierarchy of the ICD-10-CM guidelines. So this is going to be, we're going to be focusing on this far right column right here, and this is going to be the highest priority code. So here you can see first you're going to code the dependence, the highest level, then the middle level is going to be abuse, and the third level is going to be lowest. So in this scenario, there are codes for use, abuse, and dependence. So only one code is going to be assigned to identify the pattern. So based on following the hierarchy, this is going to show that we are going to code only the dependence. So it says right here, if use, abuse, and dependence are all documented, assign only the code for dependence. So this would make it false because you would not be coding all of them. You would just be coding that one, which again, I believe everyone got right. So this was an amazing warm up. You guys did awesome. All right. And we are going to take a pause before we get into some more in-depth scenarios just to check in. How is everybody doing? Are we feeling confident? If I were you guys, I would be feeling confident. We nailed those warm-up scenarios. So I think that we are totally on track to dive into some in-depth scenarios. And we are going to go ahead and get started with our first one of the night. All right. So a patient with type 2 diabetes mellitus presents for management of diabetic nephropathy. The nephropathy has been confirmed by lab results and is documented as a complication of diabetes. The provider adjusts the patient's insulin regimen. Of the following answers, which best describes the encounter? Is it going to be A, E11.9, B, N18.9, E11.21, C, 11.21, Z, 79.4, or D, E11.22, N, 18.9? I'll give you guys about a minute and a half. Good luck. All right, so I'm seeing some answers rolling in. If you are still solving, still working on it, then go ahead and do so. But we are going to go ahead and jump into this explanation. So these are going to be the keywords that you would take away from this scenario. So the keywords are going to be type 2 diabetes, diabetic nephropathy, and insulin management. And this is going to be the guideline we are going to be using. So, all right, so according to this guideline, diabetes with complications should be reported using the appropriate combination code. So the sequencing prompts you to use either category E08, which is diabetes mellitus due to underlying condition, E09, drug or chemical induced diabetes, or E13, other specified diabetes. But since we're going to do something a little different, because since this scenario is specifically stating that the patient has type 2 diabetes, we are going to go ahead and use that category E11 because it is type 2 diabetes with kidney complications. So nephropathy, that is described here in this scenario. If you don't know, that is just a general term for kidney disease or damage, which is why this category is going to be selected. So we are going to be using E11.21, which is going to be type 2 diabetes mellitus with diabetes nephropathy. And then we're going to also be using right here, because it says second, if you are using insulin, you're going to be using the Z79 code. So we are going to be including that in our coding sequence. So right here, it's going to be Z79.4. This is going to be long-term or current use of insulin. And the kidney code is not going to be coded separately. The nephropathy code isn't going to be coded separately because it's already been included in the type 2 diabetes with nephropathy. And the long-term use of injectable non-insulin drugs, as it's stated in the third code right here, is not going to be applicable because we just have insulin. We don't have any drugs right here, so we don't need this third code. So that it says if applicable, and it's not applicable, so we are not going to be using it. So that is going to make the answer for this C, E11.21, and Z79.4. I know that one was a little bit wonky just because we weren't using a code specifically that it suggested in the first line, but it does definitely work because you just have to use all of your keywords. It's stating type 2 diabetes, so you definitely can't ignore it if it's right there being documented. So I hope that makes sense. It seems like it did because a lot of you guys got that one right, so that was super amazing. And if you guys didn't get it right or you learned something, I really hope that the explanation helped. And we're going to go ahead and move on to our next scenario. All right. So, a patient with chronic back and neck pain developed a drug dependency on oxycodone, an opioid. After being taken off the drug, he was seen in the clinic for withdrawal symptoms. What ICD-10-CM codes are reported? Is it going to be A, F11.10, F11.23, T40.2X5A, B, F11.24, T40.2X5D, F11.23, T40.2X5A, or D, F11.23, T40.2X5S. Oh my goodness. I will give you guys a minute and a half or so, and good luck. All right, I'm going to go ahead with the explanation. So some of this stuff is going to be, for this scenario, is going to kind of touch what we're going to focus on next week as well. So if you guys are still solving it, go ahead. But this is going to be the chapter, we're going to focus on the chapter 19 code right here, which is going to be adverse effects. So you see right here, it had the patient developed a drug dependency on an opioid, and after being taken off the drug, they are having withdrawal symptoms. So the withdrawal symptoms are going to be the adverse effects. So you would be coding for that. So to code the first withdrawal symptom, you would go into the ICD-10, the alphabetic index. You would locate dependence, then you would go to drug, and then opioid with withdrawal, and it leads you to F11.23, and that is going to identify the opioid dependence withdrawal. So if you look right here, F11.23, opioid dependence with withdrawal. So that is going to be our first code. And then our second code, as it indicates right here, you're going to be using category 236 through 250. And you would go there, and if you go into the tabular list, it requires a 7th character. So when you see that, this is going to be the T402X5, the adverse effect of other opioids, because it says that this is an opioid that the withdrawal is happening from. And so if you have to use the 7th character, like this red box says right here, so if you go to the above indicator, it says the appropriate 7th character is to be added to each code. So you can do 7th character A, which is initial encounter, D, subsequent encounter, or S for a sequela. And this is going to be A because this is the initial encounter coming in for the withdrawal symptoms. So the 7th character that is going to be selected is going to be A. So that is going to make it T40.2X5A. And this is going to make C the correct answer. All right. If you didn't get that one, that is okay. Again, we are going to be focusing on some of that next week as well. So if you didn't get that one, don't worry about it. But again, whatever I'm throwing at you guys, you are just rising to the occasion, because I'm pretty sure, again, everyone got that one right in the chat. So absolutely outstanding. You guys are really going over your guidelines, and it is showing. All right, let's go on to our next scenario. Ooh. All righty. A patient is seen for counseling related to alcohol use. The provider documents alcohol dependence with episodes of binge drinking and withdrawal symptoms. The patient has a history of prior detox and admits difficulty quitting. Of the following answers, which best describes the encounter? Is it going to be A, F10.10, B, F10.129, C, F10.20, or D, F10.239? I'll give you guys about a minute and a half. All right, amazing job in the chat. Let's go ahead and look at our guideline that we're going to be using. Actually, just kidding. First, we are going to be focusing on keywords. So some keywords for this scenario are going to be alcohol dependence. It's going to be withdrawal, counseling, and detox history. Those are going to be the keywords we're going to be focusing on to solve this. And this is going to be the guideline we are going to be using. Alrighty. This might be the wrong one. Okay. All right. I see. Okay. So we're also going to be using that hierarchy that we were using before. So we're going to be coding the most severe condition with the use, abuse, dependence hierarchy, like we were talking about in the true or false. So with that guideline, we see that dependence is going to be highlighted in here. So in this scenario, so we're going to be coding that because that is the highest level of documentation. And there is going to be withdrawal that is going to be present as well. So with using this, we are going to be using the code F10.239, and this is going to be alcohol dependence with withdrawal unspecified. And so this is going to account for the dependence and it's going to account for the withdrawal. So with that, that is pretty straightforward for this one. I see that a lot of people got this one right. I think everyone again got this one right. So nice job, amazing work. And this is going to be from chapter 5, the mental, behavioral, and neurodevelopment disorders. So, and again, you see right here that you can see alcohol use unspecified is going to be F10.9. You just got to do a little digging for this one, and you got to look at that hierarchy again, that guideline that we were using before, and you are golden. All right, nice job, guys. Let's move on to the next one. And yes, that is going to make the answer D, F10.239. All right, moving on to the next scenario. A 25-year-old OB patient with gestational diabetes and 29 weeks pregnant arrives for a routine prenatal visit. The patient's blood sugars are normal, and the patient uses insulin and diet to manage her blood sugars. I'll give you guys about a minute and a half. Good luck. All right. I see a lot of answers in the chat. And before we get to solving this scenario, I want to hear from you guys. What do you think some key words are going to be in this scenario that are going to help us solve this? What are some key words that are standing out to you guys to help you solve this scenario? Put them in the chat. OB patient, gestational diabetes, amazing. Those are definitely things. Yes, gestational diabetes is for sure a big one. I agree. Nice job. All right. So we are going to go ahead, 29 weeks. Amazing job. Yes, 29 weeks. You guys are getting these keywords. Nice job, everybody. All right, well, we are going to go ahead and jump to, yes, insulin used. Great work. All right, we are going to hop into our guideline. All right, this is all one guideline. So we have to go into chapter 15. So if you look at the guidelines section for chapter 4, diabetes, mellitus, and pregnancy, and gestational diabetes is listed, and it prompts you to go to chapter 15 because, again, that is going to be a keyword, OB patient. So you're going to be prompted to go to chapter 15, and then this is the guideline that you're going to find with gestational diabetes in pregnancy. So that is how you're going to find that. So immediately standing out, like we said, is that the patient is using insulin and diet to manage her blood sugars as well. So when you look at this, it tells you right here to, since you're seeing the insulin and diet managing blood sugars, if you look at this far right column right here, it says gestational diabetes controlled with diet and insulin. So it says that, and then right under it, it's going to say code only for insulin, which is going to be the code 024.414. So this is automatically going to eliminate B and D. So again, using the far right corner, the sequence then directs you to code for the weeks of gestation. So here is going to be our first code, gestational diabetes, mellitus, and pregnancy. And then right here, it's prompting you to use the second, the week's gestation. And you guys brought that up as another key word to look at in this scenario, 29 weeks pregnant. So if you look at that, you can find the code Z3A.29. So at 29 weeks of gestation and pregnancy. So it's definitely important to look at this guideline right here, because if not, you definitely would probably be using a code for insulin. But this prompts you to code only the 024.414 if they are using diet and insulin. So that is why option A is going to be the correct answer. All right. Did that help? Did that explanation help? Did the guideline being presented kind of help? I know that you guys were a little like half and half split between A and C. So for people that put C, does that kind of help explain why the Z79.4 code for the insulin would not be used? Amazing. All right. Great job, everybody. Again, you always gotta dig for those guidelines, because it's more than likely gonna, put you in a different direction of coding sequencing. So definitely look out for those. But that's why we're here. Practice makes perfect. You guys are doing great. And we are going to go ahead and move to I think it's our last scenario before we go into our Kahoot game. All right. So our last scenario for the night before we do that, an 8-month-old is seen by the pediatrician today for ear pulling and excessive crying. The infant is diagnosed with bilateral chronic and acute serious otitis media. What ICD-10 codes are reported? Is it going to be A, H65.20, B, H65.21, H65.22, C, H65.03, H65.23, or D, H65.93? I'll give you guys about a minute and a half, and good luck. All right, we are going to go ahead and get started on our explanation. But again, before we get into this, because you guys did so good at this on the last scenario, what are some key words you are taking out of this scenario? Let me know in the chat. You guys did absolutely awesome last time. I think you can do it again. I have high expectations. Let me know in the chat. Bilateral. Amazing job. Yes, I would definitely say bilateral. I'm getting a lot of those. Wonderful. That is definitely a key word that you should be looking at. I agree. All right. Yes. All right. So, yes, bilateral, chronic, acute, those are definitely otitis media. All right. I think you guys pretty much nailed all of those ones. So, we are actually going to be, for this guideline, we are going to be using our general coding guidelines. So, acute and chronic conditions, because an acute and chronic condition have actually both been put in this scenario. So in this guideline is going to be located in general. And then when a condition is diagnosed as acute and chronic, there are different codes for each. So it says report both codes, sequencing the acute code first. So from there, we simply are going to go to the ICD-10-CM alphabetic index. We're going to look for otitis. Then we're going to go to media and serious, which directs you to otitis media, non-supportive. So that's going to lead you to our H65 codes, which are going to be H6503 is going to be our first code, because right here in the guideline, it tells you to code for the acute first. So acute serious otitis media bilateral, because again, that is another key word that we are taking out of this scenario. And then our next code is going to be our chronic code, like it says we should sequence. So the H65.23 is going to be our next code, and that is going to be coding for our chronic serious otitis media, again, bilateral, because again, that is a super big keyword in this scenario. And that is going to make your answer C, H65.03 and H65.23. All right. Amazing job. Did the explanation help? I know that I always, for every scenario that had acute and acute and chronic, I always had to go back and look for that specific guideline. I don't know what it was. I always had to go back and look for that specific guideline in the book. So definitely practice makes perfect. You guys did absolutely amazing on those scenarios. I hope that some of those explanations helped, and you can always go back and review this video if you ever want to get some more practice in. All right. And as you know, now that we are done with our scenarios, we are going to do a fun game of Kahoot. If you weren't here in the beginning, I know that there was a lot of feedback saying they wish there would have been a little bit more of an explanation with the questions. So I made sure to include some explanations in the end. So don't worry about that. I definitely made sure to get that done. So if you haven't played the Kahoot before, you can do it a few ways. You can go on the website, www.kahoot.it. It's just kahoot.it, not kahoot.it. I don't know why I did that. You can download the app, or you can just put your answers in the chat if you want to do that. So I'm going to give you a PIN number. You're going to put the PIN number in the website or on the app, and then you're going to make an anonymous, silly little character, and then you will be entered in the game. Thank you so much, Miss Olga, for putting the link in the chat. I'm going to go ahead and stop sharing my screen, and I'm going to go ahead and grab that game. All righty. Let's see. Start. Perfect. And I'm going to go ahead and share my screen again so we can see the PIN number. All right. Okay. Online school, yes. I love Kahoot. You can use it for pretty much anything. I used it for a book club with some of my friends last weekend. We love a Kahoot. All right, so the pin number for this game tonight is going to be 399270. I will go ahead and put that in the chat. If I can type. Oh my goodness. All right, 339270. And you can play this way, or you can just put your answers in the chat, whatever you feel more comfortable doing. And then we will go ahead and do an explanation at the end so we can still have some learning opportunities if we had any questions. Oh my goodness. You guys are really on your competitive gaming tonight. I love it. And I know after each person logs in, it gives you 15 seconds. If you didn't get a chance to log in and you want to, you can still put in the PIN number as long as the game is live. So it's not too late, but however you want to play, we're going to go ahead and get started. All right. And we are again doing our week 4 guidelines. All right. Let's go ahead and get started. True or false? If the documentation states that pain is exclusively psychological, you will still use a G89 pain category code. Is that going to be blue true or red false? Psychological pain. How are we using G89 as a pain category code? Yes or no, true or false? Got a few answers in. I'm seeing some people participating in the chat as well. Give you guys a few more seconds, maybe 10 more seconds. You got this one. I know you do. And again, we are going to go over all of these answers at the end, so don't you worry. Yes, it is going to be false. Keywords in this are going to be psychological pain. There is a guideline for that. And again, I will explain it later. Remarkable Armadillo, you are rocking it. Another true or false. Do not assign Z79.4 for temporary insulin. Is that going to be blue, true, or red, false? Great job in the chat. Great job on the Kahoot. You guys are killing it all around. I'll give you guys a few more seconds. This one's pretty. What are we thinking? I'm scared if I press this skip, it's going to skip to the. Oh, okay. All right. So it is going to be blue for true. You are not going to assign Z79.4 as a temporary code. Remarkable Armadillo. You know what's going on. You are killing it. All right, next one. If both use and abuse are documented, what code should be assigned? Is it going to be red, assign only code for abuse, blue, code both use and abuse, yellow, don't code use or abuse, or green, assign only the code for use? Again, this is going to be that hierarchy that we were talking about in the beginning with the highest level of documentation. So keep that guideline in mind when you are solving this one. I'm already seeing some awesome answers in the chat. Almost everyone got this one right. Amazing job. You're going to assign only code for abuse. You're going to be using that hierarchy. Amazing job. Remarkable Armadillo. Doing remarkable. We love to see it. All right, next question. What does the 4th character in diabetes mellitus codes indicate? I don't know why I said diabetes twice. So what does the 4th character in diabetes mellitus codes indicate? Does it indicate red, the condition is controlled or uncontrolled, blue, type of diabetes, type 1, 2, or secondary, yellow, any complications associated with diabetes, or green if the diabetes is primary or secondary diabetes? Think the definitely 4th character in a diabetes mellitus code. What is that going to indicate? You guys got this one. All right. It is going to code for any complication associated with diabetes. All right. Agile Llama, you have snuck your way to the top. We just got a few more. We'll go over the answers. If a patient has a moderate or severe substance use disorder in remission, code as substance abuse in remission. Is this blue true or red false? This is going to be, and I'm glad we're doing an explanation because this is going to be a little bit of a tricky one. So, substance disorder in remission. Substance abuse in remission. Is it going to be true or false? This is definitely going to have to focus on the words in this one. All right, so it is going to be false. Again, I will go over the explanation after this. It was just a matter of wording. Remarkable Armadillo, you are back at the top. All right, we got a few more. How do you code an encounter if a child has type 2 diabetes? Are you going to do red E11.9, blue E09.1, yellow E13.9, or green E11.0? If a child has type 2 diabetes, don't let this trick you up. I don't think it will, but don't let it trick you up. You guys got it. 10 more seconds. Amazing job in the chat, everybody. All right. Exactly. Yep. No matter what, even if it's adult or child, you're going to use E11.9 for the type 2 diabetes. Oh my gosh, there's a battle going on. Agile Llama is back at the top. All right, next one, another true or false. If a patient is admitted with glaucoma and the stage progresses during the stay, assign code for the highest stage documented. Is this going to be blue true or red false? If a patient is admitted with glaucoma and during the admission their stage progresses, are you going to assign code for the highest stage documented? True or false? True or false? You guys got this one. Oh, this is wrong. It is true. I don't know what this came from. This is my mistake. That is 100% true. You are coding for the highest. I'm so sorry. I don't know what happened. This is going to be our last one of the night, and we will get to our explanations. What ICD-10-CM category is used for pain? We just went over this in one of the other questions. Is it going to be red Z20, blue G89, yellow R18, or green G80? What ICD-10-CM category is used for pain? You guys got this one. And I promise I put in the correct answer for this one as well. Great job in the chat. Give you a few more seconds. All right, indeed, it is going to be the blue G89 code. Great job. Who came out on top? I'm so sorry for Agile Llama. That was a battle. You guys really went through that. All right. I'm going to stop sharing my screen, and I'm going to share back to my PowerPoint so we can go over some of these answers. All right. Alrighty. Amazing, amazing. Okay. So those were randomized, but these are going to be the questions. and I will go over the answers. So the first one, if a child has type 2 diabetes, so there is no guideline or category specifically for prenatal or child diabetes. So you would use the same code as an adult with type 2 diabetes. Everyone pretty much got that one right. So amazing job. The next one, the fourth character in diabetes mellitus, what does the code indicate? So this is going to code any complication associated with diabetes. So an example of this would be like kidney complications. So E11.2, type 2 diabetes with kidney complications would be an example. So your E11 is going to code for the type of diabetes and what category. And then the 2, which is going to be the fourth character, would be the kidney complications. So that's why the fourth character is going to be used for the complication associated with diabetes. All right, number 3, if a patient is admitted with glaucoma and the stage progresses during the admission, assign the code for the highest stage documented. I don't know why I put false. I think I tried to word this different and it didn't work out, but just ignore that. It is true. It is 100% true. So you would definitely code the highest stage, and you would not code the stage that they came in with. If the stage is progressing, you assign the code for the highest stage documented. So I apologize. That is true. All right, moving on to the next one. If both use and abuse are documented, what code should be assigned? Pretty much everyone got that one right. You would assign only the code for abuse. So like I said in our Chapter 5 guidelines about how to code use, abuse, and dependencies, if both use and abuse are documented, you're going to assign only the code for abuse. So that is definitely a very important guideline to use when these are being, when both of these words are coming up in a scenario. So definitely make sure that you can access that guideline for sure. All right, question 5. If a patient has a moderate or severe substance use disorder in remission, code as substance abuse in remission. So this is going to be false. And again, this is going to be a Chapter 5 guideline. So the guideline is going to be mild so the right code. And if you want the exact code, definitely click the link in the survey and I can send it to you. But it's in Chapter 5. It says mild substance use disorder in remission. You would code as substance abuse in remission. And then if it's moderate or severe, so there's 2 different kinds. There's mild substance use disorder and there's moderate or severe substance use disorder in remission. So if it's a mild abuse in remission, then you code as substance abuse in remission. But if it's moderate or severe substance use disorder, you're going to code as substance dependence in remission. So it's really just, that's what I was saying. It's really just a matter of the wording. If you look at that guideline in your MCG manual, it definitely breaks it down really well. So I know this one was a tricky one. I was just trying to be a little tricky. I don't know. But yeah, so that's the guideline you would look up to better understand that question. Number 6, what ICD-10 category is used for pain? This one is pretty straightforward. You're just going to be using code G89, and that's the one that you're going to be using. And then question 7, if the documentation states that pain is exclusively psychological, would you still use a G89 pain category code? This is false. So again, in the Chapter 5 guidelines, it says to not use G89 as a pain code for pain exclusively psychological. That's why psychological is such a key word. So an example of psychological pain, I cannot say that word today. An example of that kind of pain is going to be like fear, despair, grief. That's going to be an example of psychological pain. And so you would not use the G89 code for that. You would assign a code from F45.41. Again, you can see this if you go in the MCG manual and you look at the Chapter 5 guidelines. It definitely is in there. But yes, that is why the answer is going to be false for that. And then the next question, true or false, do not assign Z79.4 for temporary insulin. A lot of people got that one right. So again, using the Chapter 4 guidelines, it says to not assign code Z79.4 for long-term current use of insulin if it's given temporarily to control a type 2 diabetes mellitus patient's blood sugar during an encounter. So if a patient's going in and they receive temporary insulin or temporarily just to control the diabetes, you would not code for long-term use of insulin. So that is why you are going to put true for this, because you are not going to use this code for temporary insulin. All right. I know that was a lot of explanation. And if you need any more explanation from the questions on the Kahoot game, or if you need any explanations for any of the scenarios or questions in this lecture at all, we are going to put a survey in the chat. My wonderful team is going to put a survey in the chat, and definitely click on that if you have any unanswered questions. We definitely want to make sure that you understand all of these concepts as you best possibly can. So don't be afraid to reach out. We also would love for you to click on the survey to give us some feedback. Ooh, this is actually going to be our last one. All right. To give us some feedback. We would love to know how we can better improve your learning experience. We love it when you guys come to our classes, and we love when you are just nailing all of these scenarios and really getting all of that practice in. So we really appreciate you attending all of these classes. And we have many more live classes that we're going to be having this week. So make sure to check those out. And I know I said it a million times, but definitely click on that link and make sure. Yes, thank you so much, Miss Olga. She shared the link in the chat. Make sure to tell us how we're doing. If we can improve how you think we're doing, we would love to hear any kind of feedback. It definitely helps us with these classes for sure. And I definitely appreciate you guys taking time out of your day to join us on a Monday night. And I hope that everyone comes back next Monday, and I hope to see you guys next week or at some of the classes that we're having this week as well. You guys have a wonderful and awesome rest of your day, and thank you so much for joining us. $4,000 exam passers and free classes at AMCI. Learn to coach straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all around.